Sexual function following spinal cord injury for women. Please take a moment to pause and read our disclaimer. In this video, we will talk about the impact on sexual function following spinal cord injury. We'll talk about fertility and knowing that you're still able to carry a baby if that is applicable and you're interested. We hope to ease your fears and open your mind to thinking about participation in sexual health and intimacy again. We like to start with sexual health is part of your health. So whether it's on your mind right now or on your mind in the future, knowing that if there are issues related to sexual health, you can reach out to your medical provider for additional resources and be empowered to know that this is part of quality of life, and so we want to be here to support you. First things first, we're going to talk about menstrual periods for those that this is applicable for. There can be a temporary interruption in your cycle following spinal cord injury, and that can be anywhere from 2 months to 12 months depending on your body. For most women, your menstrual cycle should return within 6 months, and then ovulation may still occur even when you're not having a period, so something to be aware of. And when it does return, it may increase your spasticity or your risk of urinary tract infections. Many people wonder, should I use a tampon or a pad? It is your personal preference. With tampons, they do not contribute to skin irritations. There's no moisture in the area, which is great. There's protection during transfer, and oftentimes it needs to be changed at least 3 times a day at a minimum. And there is a risk for autonomic dysreflexia in cases where that tampon is not getting changed frequently enough. Pads can be helpful for keeping your skin clean and dry, but you do want to check for irritation as well as pressure from that pad. When it comes to birth control, spinal cord injury does not impact your fertility. So deciding what birth control is going to be best for you and work for you is really important. With pills, there is a higher risk of blood clots. For everyone, not to spinal cord injury, but when there's a higher risk from spinal cord injury, that's something to consider. So you'd want to regularly check for swelling, color changes on your skin, temperature changes in your skin. If you choose to do an intrauterine device such as an IUD, there is a higher risk for pelvic inflammation, and they can be difficult to detect if there's pain, and so in some cases it can cause autonomic dysreflexia episodes. We like to ask, what do you think the largest sexual organ is? Take a minute, think about it. It's your brain and your skin. So the sexual response is when your brain is coordinating a reflex with your body to elicit a sexual response. And when everything's working smoothly, the brain and spinal cord work together. To talk about our sexual organs and make sure that we're all on the same page, I'm going to use my mouse to make sure that you can see here what I'm talking about. So your vagina is where intercourse typically happens, or self-pleasure with a sex toy would happen. The clitoris is not pictured in this illustration. However, it is very important with eliciting orgasm. It's the counterpart to the penis in women. The ovaries are where the eggs are in a woman. They produce the eggs. The fallopian tube is where the eggs travel. The uterus is where a baby would be housed if you were pregnant. The cervix is the space in between the vagina that goes into the uterus. And then the labia are the folds of skin on the outside of the body. The impacts of spinal cord injury does not impact your anatomy. Your sexual anatomy, you still have your fallopian tubes, you still have your uterus, you still have your vagina, all of that, none of that has changed. But your response to sexual stimulation will have changed based on the impact and the amount of sensory nerves that are able to communicate past your level of injury or not able to communicate. And everyone's changes are very unique to their own injury, and they can also change over time. So we like to think about teamwork, and that these nerves don't just stop working, but they aren't necessarily able to communicate the way they did before, and so it may take other nerves working together to achieve the goal of an orgasm. So once again, that the nerves don't just stop, they just aren't communicating. Lubrication is very important post-spinal cord injuries. The vagina may be more dry and require external lubrication. And we would recommend that you use a water-based soluble jelly. We know that there is a lower risk of urinary tract infections and lesser risk to irritation of the tissue when using water-based lubricants. Orgasm is a complex coordination between the nerves, the vagina, the clitoris, and the brain. Most people report that they're able to achieve an orgasm to some degree. It may require extra time. It may not feel exactly as it did before, but that it is achievable. And the length of time to achieve it may also be different. So tips from other individuals with spinal cord injuries, as well as research, are really to think about like you're having sex for the first time. So with this, we mean think about having good communication with your partner is extremely important. Having a good sense of humor about things, because it may not be great the first time, and to that point really knowing that it'll get better with practice. So not being afraid to continue trying and seeing what's going to work for you, either with self-pleasure or with pleasure with a partner. Experimenting with all of your senses, so utilizing as many pathways as possible. So the touch pathways, the scent pathways, music, touch, taste, anything you can to really elicit a sexual response or orgasm. And then exploring your pleasure zones, if you're able to yourself or with the help of a partner, really finding new areas that might be heightened in sensation. It might not be an area that you had heightened sensation before, but now becomes extremely pleasurable. Finding those areas and using them to help elicit the sexual response is really important. So for those who it's applicable for, fertility and pregnancy, having a child is still possible. Education specific to pregnancy and spinal cord injury is available upon request. And there's some great resources through Model Systems as well. The big things that would need to be monitored are your blood pressure management, thinking about equipment as your body changes size, as well as functional independence with body changes. It is possible, but definitely worth talking to a medical professional and an occupational therapist to really help with problem solving some of these things. And a spinal cord injury fertility specialist referral is available through your rehab doctor as you're interested. For additional resources, we really highly recommend you take a moment to scan this. And if you haven't already been to our Nielsen Rehab Community Resource Library, go to the Parenting and Sex section and you'll find some wonderful videos there that really give you a better idea of what positions you could use, what sex toys are available, and really explore what could this look like with my current function. And if you're interested, you can also talk to our social worker about our peer health coach program and see if there's somebody in the community who has a similar situation and you can talk to about things related to this topic as well as others. So the less fun thing to talk about is precautions, but we do really want to be mindful of your skin. We want to be aware of how long you're in a position for and avoiding shearing. We want to maintain spinal precautions if you still have spinal precautions. And so starting with like a cuddling or side-by-side position might be the best option initially. And then emptying your bowel and bladder before, just as you would normally, you'd want to make sure that you don't need to go to the bathroom. While emptying your bladder and your bowel will help minimize the risk of having incontinence during orgasm. And then protecting against sexually transmitted diseases or unwanted pregnancy is something also to be aware of. And last but not least, for those of individuals who have an injury at the T6 level or above, you may be at risk for autonomic dysreflexia or AD. And so just being aware of monitoring those symptoms. For your women's health exam considerations, make sure you ask your gynecologist's office about the accessibility of the office and the building and the exam tables, and if staff would be able to assist with transfers and positioning during the exam so that you continue with your preventative health care. And then with menopause, there really is minimal impact of menopause. In some cases, it can happen 1 to 2 years earlier than maybe it would have before. And you may have an increase in AD or spasticity, bladder spasms during menopause. And then the risk of osteoporosis is a bit higher with spinal cord injury. Finally, many people report that fears decrease over time as you become more comfortable with your body and aware of your own sexuality. Self-pleasure and pleasure with a partner is still possible. Sometimes it requires some creativity. Working with an occupational therapist, talking to other peers can be really helpful with figuring out what options would be available, what mounts or control, sex toys, all sorts of ways to kind of incorporate more independence with this area. And then good communication with your partner, if applicable, is key. So think about what questions you have, and please reach out to your rehab educator or anyone on your medical team that you feel comfortable discussing this topic with. Thank you so much for watching, and know that our resources are available upon request. Have a nice day.